Today we're going to talk about cases in which pain returns even after spinal surgery. We'll take a closer look at why this happens and how treatment should be approached when revision surgery becomes necessary. Hello, Dr. Sang-ho Lee.
Hello. Nice to meet you.
Many people make the decision to undergo spinal surgery very carefully, and they often believe that once surgery is done, the problem is completely resolved. However, in some cases, pain can recur over time. Why does pain sometimes return after spinal surgery? And why do some patients ultimately require revision surgery?
Revision surgery may be necessary because the spine is made up of multiple segments. Even in the lumbar spine alone, there are 5 vertebrae. For example, a patient may initially have disc disease at L4-L5 and spinal stenosis at L5-S1. Even after those levels are treated, new problems can develop at other segments over time. Another situation involves patients who have undergone spinal fusion. Once a level is fused, it no longer moves, which increases stress and motion at the levels above and below. About 25% of these patients eventually develop problems at those adjacent segments. There are also patients who undergo decompression surgery only, using an endoscope or microscope. In some cases, spinal instability can develop later, making revision surgery necessary. In addition, some patients have multiple conditions at once, such as disc problems, facet joint disease, and degenerative changes of the vertebrae across several levels. If only one area was treated initially, or if the overall condition could not be fully addressed, revision surgery may also become necessary.
I've heard that spinal revision surgery is extremely difficult. Because of anxiety about revision surgery, some patients delay visiting the hospital or go from one place to another, only to be told there is no solution, which makes them even more fearful.
Spinal revision surgery requires special caution. If the first operation was performed through a posterior approach and the revision is attempted through the same route, the success rate is only about 50%, which also means there is a 50% chance of failure. This is because adhesions form at the previous surgical site. Just like scar tissue develops after a skin injury, adhesions form around the spine after surgery, which significantly limits revision options. That is why, if the first surgery was done from the back, successful revision often depends on changing the approach, such as using an anterior or lateral route instead of repeating the posterior approach.
You mean the surgery is done through the abdomen? But the spine is in the back. How is it possible to reach it from the front or the side?
The abdominal organs can be gently moved aside. Once they are retracted, we can access the disc directly while avoiding vital structures. This allows us to completely remove the damaged disc. With a lateral approach, major blood vessels can also be avoided. Because we enter through natural anatomical spaces between muscles and vessels, neither muscles nor blood vessels are injured, and the surgery can be completed efficiently. By contrast, posterior surgery often requires extensive dissection to create working space. Blood loss can reach up to 3,000 cc, sometimes requiring transfusion. With an anterior approach, blood loss is usually limited to about 50 cc, so transfusion is not needed. In addition, the incision is typically made horizontally, around or below the navel. When we go directly through the navel, the scar is barely visible. This approach also makes it much easier to replace the damaged disc with an artificial disc.
Wouldn't approaching through the abdomen be dangerous? The pathway seems very long.
Anterior spinal revision surgery cannot be performed by a single surgeon. It requires a multidisciplinary team. This includes an abdominal surgeon, thoracic surgeons when thoracic disease is involved, orthopedic surgeons, neurosurgeons, and most importantly, an anesthesiologist who oversees the entire procedure. Another essential member of the team is the radiologic technologist. Because spinal orientation differs from patient to patient, precise navigation using specialized instruments is required to accurately localize the target. That is why this surgery must be performed as a true team effort.
So Wooridul Spine Hospital has a dedicated team specifically for spinal revision surgery. Many general hospitals avoid accepting revision cases to reduce risk, which shows how complex these procedures are.
Revision surgery is complex, technically demanding, and carries a risk of failure, so it should be performed at a hospital that specializes in spinal revision. Patients come here from all over the world. People who previously had surgery in the United States, Germany, the United Kingdom, or Japan later come to Wooridul Spine Hospital in Korea because we change the surgical approach and operate through multidisciplinary collaboration. That is why patients come from around the world. Some even arrive by private jets, while others make reservations months in advance. It has truly become a global center for spinal revision surgery. There was once an ambassador from South Africa who had undergone surgery in Singapore. Unfortunately, because of complications from that operation, he was almost unable to have a normal married life. His wife, a former Miss Universe and an incredibly beautiful woman, had no choice but to live in a separate bedroom. The ambassador often said how sad the situation was. I performed revision spine surgery on him. How did we do it? We went in through the navel, completely removed the damaged disc, and replaced it with a new artificial disc. After the surgery, he told me, "Coming to Korea has given me a new beginning in life. For the first time in years, I can finally share the same bedroom with my beautiful wife again." When he later shared his story with journalists and doctors in Dubai, word spread quickly. Since then, many patients have traveled from South Africa to Korea for medical tourism, seeking a new life through advanced spine surgery.
Listening to your explanation today, it seems there is no need to be overly fearful simply because revision surgery is required. Of course, the best outcome is a successful first surgery, followed by proper self-care. However, when revision surgery becomes necessary, it is essential to establish a careful treatment plan with a medical team that has specialized expertise. Thank you very much.